Dr. King, thank you so much for joining us today. I am truly honored to have this conversation with you for all mamas out there.
Yes, absolutely. Thank you so much for having me, Carly.
Tell us a little bit about yourself and how you got started as an OBGYN and why you decided to pursue this passion or this profession in the first place.
So I'm a board certified OB-GYN here in the Chicago area. And I, interestingly enough, got started in OB-GYN or with a desire to do OB-GYN when I was in med school. You know, some people know like when they're 5, they want to be an OB-GYN. I knew when I was younger, I wanted to be a doctor. I didn't necessarily know what kind. My mom says I wanted to be a pediatrician, but I kind of remember that. But when I got to undergrad, my major was actually in kinesiology, which is basically the study of movement in the body. And I did athletic training as my major. So when I, ended up going to medical school, I said, oh my God, I'm going to do something with my athletic training major. I'll do orthopedics. And I remember when I did my orthopedics rotation, I was like, I feel like I'm in a mechanic's auto body shop. I mean, it was kind of fascinating and really cool, but it just wasn't for me. I mean, the hammers and I was like, and for us, it was only a 2-week rotation, but I was like, this is not for me.
Yeah.
So then I said, okay, what else? Because I was kind of not really stuck, but I was set a little bit on doing something with athletic training because I had spent all that time in undergrad, and it was really a great foundation for medicine in general because we learned anatomy and physiology. And I was just kind of like, I want to do something with that. And so then I said, well, maybe I'll do physical medicine and rehab. Think of a physician who takes care of someone with a traumatic brain injury or stroke, not a neurologist, but it's a slightly different thing. And at that point in my medical school career, I had already done my general OB-GYN rotation that all medical students have to do. And so I went on to do, this is my 4th year of med school, by the way, my last year. My first rotation of 4th year was a physical medicine and rehab rotation. And I got there and, it was kind of interesting, but I remember the first day being like, nope, this is not for me. And I literally remember thinking, I'd rather be doing a C-section right now.
Wow.
Or like operating or, not that. That was the first day. And so I was like, time to switch things up. And I loved my OB rotation. I loved it. Like, one of my favorite things, and I think what drew me to it is that in general, I'm taking care of healthy women for the most part, although, the health of our society is changing a little bit.
Yeah.
But generally they're healthy, and I get to take care of them through various stages of their lives. So whether they're a young woman who's 15 or 16 with menstrual complaints, whether they're 25 and they're having their first baby, they're 30 and dealing with fibroids or endometriosis, they're menopausal, and then I got to see them in a variety of settings. So we have, regular office visits where patients are coming in for their annual exam or, an issue. We have the labor and delivery unit where we're doing deliveries and C-sections. And then you have the OR where you get to operate and do, surgeries and hysterectomies and, removing cysts and all that kind of stuff. And so that I loved the variety. I wasn't just kind of in one place doing one thing. And I loved that. And I don't think I realized I loved it until I did it. And then I ended up doing something else that I thought I was going to love. And I was like, but it just goes to show you honestly that, you have to continue to forge your own path and not to get so stuck in your ways that you limit yourself. Because if I had just been like, nope, I have to do physical medicine and rehab because I did athletic training in undergrad and I have to make sure I use these skills. And, I would have ended up doing something that I truly didn't want to do.
Right.
And like I said, I just really loved OB. I loved the experience I had on my OB rotation. And so immediately once my physical medicine and rehab rotation was done, it was like a 4-week elective. Well, prior to that, I basically got the wheels moving to get some more OB electives in place. And I was just like, I'm doing OB, and that was it. So
Cool.
I love the variety. I love taking care of women. So it was a perfect match.
Oh, that's so awesome. I just have, such admiration and respect for the work that you do. I'm a C-section mom myself,
Yeah.
because my baby was breech and
Ah,
he was not. We tried everything to turn him around.
little stinker.
Oh my gosh. And we did a breech version, which was the
Yeah.
most painful thing I've ever experienced. I mean, this kid was not moving. And I was like, you know what? This is the way it was meant to be. I don't
Yeah.
feel
Yeah.
comfortable doing a vaginal birth as a first time mother. So I had a C-section and I get goosebumps thinking about it. But I looked at my OBGYN after, who was just the woman on call that day.
Yeah.
And my whole team was female in the
Oh,
OR.
that's awesome.
And I just looked at her like, holy shit, thank you so much for listening to me and making this experience as close to what I had originally had in mind. And
Yeah.
just such strength and such calmness that she had. And so it's really, I'm so honored to have this conversation with you today.
Oh, that's awesome. Yeah, I actually just made a video about why you might need a C-section. I totally left off breech. I totally forgot about that one. When I make, I record videos and just kind of informational stuff, but I literally just did that before I was talking to you. And one of the big things that I said is that we have to help moms just understand some of the basic processes that are happening so they're aware. So there's not this big, like, I'm coming in and having my baby. Like, I have moms ask me all the time, there might be like 28 weeks. So, am I going to be having a C-section or normal delivery? And I'm like, I don't know. Like,
Yeah.
trust me, if I could predict that, girl, I would be rich and out the door. Maybe
Right, exactly.
But, it's one of those things I tell them, I'm like, I cannot predict this. Now, if a mom comes in and it's her fourth baby and she's had 3 previous vaginal deliveries, the likelihood is that she's probably going to have a vaginal delivery. But probably means that there's a little room that she might have a C-section.
Right.
If she comes in and she's hemorrhaging and we think that her placenta's abrupting, she's getting wheeled back to the OR unless the baby's literally also coming out.
Right.
And so I think the more we can help prepare a mom prior to the delivery, just conversations. And I know, we don't always have like the luxury of having hours and hours to have conversations, which is why what we're doing now is important, because moms can search and find information from reliable sources, and then they can feel comforted and they can feel like, okay, if I have to have a C-section, even though a vaginal delivery was my goal, it's not the end of the world. And literally what I said in my video is what I always tell moms, that what my goal is, even it's not my baby, but what my goal is that I have a healthy mom and a healthy baby walk out of the hospital, period. Get rid of all the other stuff.
Right.
Like that 5,000 page birth plan.
Bye.
And I mean, and don't get me wrong, like, sometimes I think that can be very empowering for people to have a birth plan. I think that's fine. But again, you have to make your relationship with your physician a collaborative one.
Right.
One where there's a sense of respect that goes both ways. If your doctor is just like shooing you off and like, no, you're fine, or, that may not be the right person for you, because you want someone to hear you. You want someone to validate your concerns. So never should anybody feel that their concerns aren't being validated.
Yeah.
But at the same time, there has to be that trust, that you trust your physician. Like, I'm certainly not going to do anything to anybody that's going to cause me to jeopardize my integrity, my license that I worked so hard for 5 gazillion years to get. So we just have to make sure that we're operating in a way that we're respecting both parties, And I think if patients and physicians operate that way, it'll be such better place. Like, I see things all the time online that are like, doctors just want patients to have C-sections. And I'm like, I don't know what doctors you're talking to, because if everybody had vaginal deliveries that went smooth sailing, it will be so much easier. Again, not that giving birth is easy or there's no pain or anything associated with it, but certainly typically vaginal deliveries are associated with less complications, less
Right.
bleeding, and all of that stuff, less recovery pain, all of that. So, when I see some of those things, I think it sometimes signals a lack of mistrust that
Mm.
we have to figure out how we can gain and work on making sure that trust is there. I just went on about 5 zillion different things all in
No.
one answer, but yeah.
No, it's so helpful, to hear from your perspective as a healthcare provider. I think that there is a big, from some of the moms I've spoken to, there is a mistrust of doctors. Like,
Mm-hmm.
oh, they're just going to try to make me have a C-section because it's more
Mm-hmm.
convenient. I was
No.
I was trying to have a birth center birth, and here I am, like under the
Preach.
scalpel, like totally opposite. And you bring up some really, really great points about having this two-way respect and trust with your doctor. And there's a post on your blog that, and you're on your website, that talks about self-advocacy. And
Mm-hmm.
for me, I can self-advocate for myself any area of my life. I feel confident
Mm-hmm.
to do so, except when I was pregnant,
Mm.
because I was so damn scared. And
Yeah.
just, you know, I had never been there before. I didn't know what to ask for because I had no
You
prior,
didn't know.
I had
Yeah.
no prior experience to compare it to. Um, and I've spoken with a lot of first-time moms who feel the same way. Obviously the second time around, I'm gonna have a better sense for sure. So what advice could you give to first-time mothers to help them kind of, first of all, feel that sense of trust in their doctor, but then also become a better self-advocate once they're in the office?
Yeah. So I think the first thing they can do is find a doctor who is in line with their personal belief system, and not and even beyond belief system, just that they feel good with.
Mm.
I mean, patients will come to my office and we're talking about the macaroni and cheese recipe for Thanksgiving. You know,
Yes, I love that.
you want to feel comfortable first and foremost. So, how do you do that? It may be helpful for you. You may be the type that says, I don't want to look online and find a doctor. Let me go ask my girlfriends who they saw. More than likely, or hopefully, if it's somebody that you love and trust and care about, they're going to give you an honest answer like, hey, I really liked my doctor. I had a great experience. Even though, my birth didn't go exactly whatever, I still trusted them. Those are the things you want to hear that are going to at least kind of reassure you going in, because honestly, some people, the first time they are going to see an OB-GYN is when they're pregnant. For whatever reason, they may not have had a well woman visit before, so this is their first time going and encountering an OB-GYN. So if you can get personal recommendations, word of mouth, I think, just goes so far. So that's one thing. I have patients all the time that come and they're like, oh my God, my aunt told me to come to you. And I'm like, oh, because that means that aunt trusted me and then went
Right.
on and told somebody, or their sister or whoever. So that's one thing, is trying to find out up front. Then if you get to the doctor, whether you've had word of mouth or not, you're going to be able to tell pretty quickly. I mean, obviously things can happen if they are running around like crazy and going to do C-sections and getting paged and stuff like that. It may not be the best representation of themselves, but you can still get a pretty good idea about people. Like, and I don't know, maybe this is just me. I have some friends that are like, I think you're the exception. I'm like, I hope I'm not the exception. Lord, please don't let me be the exception. But regardless of how crazy a day is going, people can still be kind.
Mm.
And so you can still get the sense of if someone is kind.
Yeah.
Now, like I will literally walk in a room and I'll be like, I'll never have met this person. I'm like, I am so sorry. This day has just been crazy. I know you have been waiting. Your time is valuable. And it just goes back to that mutual respect. Like, I don't walk in late for a patient and be like, okay, I'm here now. What do you need? You know what I mean?
Mm-hmm.
I'm sure some people have had experiences like that. You know what I'm saying? And so I think you pick up on those cues, pick up on those small little things that you may not think mean anything. It's funny, I saw somewhere and I was like, oh, I don't do that anymore. I hope nobody cares. But I saw somebody that was like, they didn't even shake my hand when they came in the room. And just, especially in these days and times,
Yeah,
especially.
don't shake my hand.
But even before then, there's just so many germs that I literally go in the room. I'm like, hey, how's it going? As I go to get some hand sanitizer. And I don't really personally do a handshake anymore. So I don't want anybody to think like they didn't shake my hand. I've seen people say that before. And I was like, oh. But you know, I won't say it's old school, but it's something we learned that in medical school. When you go into the room, introduce yourself to the patient, shake their hand, wash your hands, da, 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 da. And so I've just kind of made it my practice that I go in with a big old smile and that big energy. I mean, I'm a big energy kind of person. If you haven't figured that out,
I love it. Yes.
You haven't figured that out. And I've never had a patient be like,
yeah,
hands. But they can tell automatically that I'm there and I'm there to be engaged with them. And so I think, you know, again, finding somebody by word of mouth, picking up on small clues, not ignoring if you feel slighted or if you feel ignored, if you feel unheard. Don't ignore that and be like, oh, it'll get better next time. And maybe it will. Like if certainly their staff has come in and said, we're really sorry, Dr. So-and-so is running behind. He's in emergency surgery. And then they get there and they're a little flustered. You can extend people some grace. I'm not just saying just cut everybody off at the they said one wrong thing, but you definitely can get a feel for someone in those first few minutes, in that first encounter. In terms of tips on how to advocate, you know, you can come with questions written down, because sometimes once you get to talking and you may be having a great conversation, be like, oh man, I really like this doctor. And then you forget all your questions.
Yes.
But having some questions written down, if you're going for a routine wellness exam or an annual gynae exam, you may not really have a whole lot of questions. If you're just going for routine and you're healthy and you don't have anything going on. So that's okay. But if you are going with some concerns, write some questions down. Bring someone with you if you feel comfortable with them, you know, being privy to your medical information. Because sometimes having two sets of ears is better than one. But don't be afraid to ask questions. I'm sharing lots of personal stories because I think it's helpful for people to hear, like, oh, people really go through this.
Yes.
But I remember I had a patient's family member say, she's like, I'm sorry, doctor, you know, is it okay if I ask a question? And I was like, ma'am, that is why you are here. Like, if anybody has ever made you feel bad, which they probably had, or she wouldn't have given me this disclaimer. If someone's making you feel bad for asking questions about your medical care, that is a problem. You know, and so again, these are all cues that people can pick up on. And when you have someone that's listening to your voice, that's giving you a voice and giving you space to be heard, those are all signs that this is somebody that I should be able to trust. This is somebody that I can come back for another visit and continue to build and develop a relationship with. And I mean, those are just some small things, but those are some pretty key things that I think women can do. You know, I'm saying women because I obviously know the gynae, so I see women. But obviously anyone can do, whether they're seeing their primary care doctor for diabetes or high blood pressure. You know, these are things that anyone can do to advocate for themselves. And I think having these conversations, it's important because it allows people to realize they do have a voice.
Yes.
Unfortunately, in the history of medicine, there has been a lot of paternalism. That's one of the tenets of medicine that we learned in medical school. Paternalism, patriarchy, they kind of go hand in hand in that back in the day, people would go to the doctor and literally sit down and just hear what the doctor had to say. There wasn't a whole lot of, well, actually, I read on Google, or actually, I did my own research, or actually, my friend told me, you know, on and on and on. It was like you sat down. You see it in movies all the time where they go and they're getting some grave diagnosis, and the doctor's like, "You're not gonna make it."
Yeah.
And then the people are just sitting there like,
Okay.
There's no, we're going to send you for a second opinion. There's no, and, you know, obviously there have been tons of advances in technology and in medicine. So everything has changed, but there are, you know, there can still be those ways and those practices that find themselves into people's practices, or find that they've never left someone's practices. Maybe they've been practicing a really long time. And, you know, so it's okay to realize that those things exist, and that your relationship with your physician doesn't have to be defined by that. And you can advocate for yourself, and you can have a voice. I think for some women, as you mentioned, it's scary because it's a situation you've never been in.
Right.
So you're like, you know, if you were like going to the grocery store and something happened, you can be like, no, this is not right.
Right.
I bought these bananas, or, you know,
I've bought these bananas before. I know these are not right.
I know that, you know, I know that this is what they're supposed to be.
Right.
But in medicine, like, I think what intimidates people is most people going to the doctor are not also physicians. And so therefore, they're not necessarily an expert in that. And so then you kind of feel like, well, I'm coming to an expert. Who am I to question them?
Yes.
Who am I to speak up? Who am I to say anything contrary to what they are saying to me? And so I think that can play and factor in for some women as well.
Absolutely. Absolutely. I mean, there was a point in my pregnancy that I went into preterm labor at 35 weeks. They think because he was breech, right? And so uncomfortable, and my body was like, get him out. This is not working. And my nurse, I was working with a nurse midwife at the time because I had planned to give birth at a birth center, yada, yada, yada. So she came to my appointment with me because I was going into labor and I had no idea. So she's like, do you want me to come with you? And I'm like, actually, I do, because I don't feel confident enough to advocate for myself. And not to mention, I'm like a total basket case going into labor right now. I remember when we got to triage, the doctor or the nurse in triage said, you know, we need to examine your cervix. And I was like, in my mind, oh my gosh, my nurse midwife just examined my cervix. I'm already bleeding from it. My body is going into labor. Thankfully, I was now at 38 weeks. And the nurse midwife turned to me and said, you can say no to this. And I was like, what? She's like, you can say no to the nurse examining you. And I was like, what? Like, I had no idea.
Right.
That
the autonomy
in that matter.
Patient autonomy.
And I feel like I know that I'm not the only woman who didn't know she had an option to decline an exam. And that was really, really eye-opening for me, because I was like, well, what else did I miss?
Yeah. So, it's interesting. And I think that part of that is absolutely having autonomy as a patient, and just knowing, like, it's your body. Like, no one can make you do anything.
Right.
But also knowing that it you know, it's a fine line. Voicing, you know, you can voice your concern and say, hey, you mentioned you need to examine me. Can you tell me why you need to do that? Because maybe there's a very legitimate reason as to why they need to examine you. Say there's no ultrasound machine nearby, or it's being used and there's no capacity for it to get to you for any, you know, time soon. And they say, you know what, we need to examine you to see if the baby's head is down. Because if the baby's head is down and you're 35 weeks and 2 centimeters and everything else looks fine, who cares?
Right.
But if the baby's head is down and you're 5 centimeters, I mean, if the baby's butt is down and you're 5 centimeters, and I can tell that on an exam, that's information I need to know.
Right.
So, but it just goes with everything that it's all about communication. It's literally like, when I talk to patients, I try my best to explain to them exactly what I'm thinking, what's going on, so that they understand.
Right.
You know what I mean? When I'm having those conversations, it's much easier to understand when you get to the hospital what certain things may happen if you've had that conversation with your doctor. So that goes back to when you come for your visits, you know, ask some questions. I mean, if everything is going smooth and you just don't have questions, like I'm not saying force it and just make up a 25 questions, but feel free to ask questions. But I feel like if we can prepare people before they get to the hospital, and it doesn't take long. Like, I mean, literally, if I'll give you a prime example. If I have a patient that is going to be induced and I'm sending them to be induced, I will literally tell them, okay, say I'm sending them, it's kind of unexpected, but they're in my office and they're 40 weeks and their blood pressure is 160 over 100. I'm like, girl, this pregnancy is over. Like, this baby can't stay in here any longer. Like, it's not safe. But I tell them why. I don't just say, go to the hospital, we're inducing you. And they're like, what? Like, I'm not going to go to the hospital. I don't want my baby to come. I'm not in labor. You know what I mean?
Right.
But sometimes those things do happen.
Yep.
And then a person, instead of following orders, goes home and they have a seizure or they stroke out. People will follow orders or won't follow orders, and they'll go home and something bad will happen. But if I say, look, I'm really concerned. You're 40 weeks or however many weeks. The baby will be perfectly fine to come now. The lungs are developed. Everything is nice and strong. Your blood pressure is very concerning. If you don't go to the hospital to have this monitored and then to get delivered, you may have something called preeclampsia. You may have something called gestational hypertension. Those things can lead to a mom having a seizure. Those things can lead to a mom having a stroke. You are young, you are healthy, and you have a baby that you want to take home with you. So, in order for us to make sure we have the safest delivery, I need you to go to the hospital so that they can evaluate you, and you will likely be induced because of how far along you are. Now, in terms of induction, I'm going to check your cervix today. You know what that means? I'm going to check and see how far dilated you are.
Mm-hmm.
And then I go on to say, okay, you're 2 centimeters or your cervix is closed. So based on that, this is likely what they're going to do when you get to the hospital. You're 3 centimeters, it's your third baby, they're going to give you some Pitocin and get some contractions going. Or this is your first baby, your cervix is completely closed. They're going to place a medication in your vagina to help soften the cervix, ripen the cervix, and get the labor process going. And then, you know, if you want something for pain, this is what you can anticipate. Inductions can sometimes take really long. You know, you're not walking across the street and the baby's just going to fall out. You know, these are literally conversations I have all of the time. It is not just you need to be induced because I said so, go across the street. And so when I explain things in those terms, most people are like, oh, okay. Well, and they've typically gathered that I care about them because I've cared for them during their pregnancy.
Right.
And, you know, we've established a relationship. But when I continue to explain and voice my concern about real things, this isn't, you stubbed your toe, you must go to the emergency room now, you're 6 weeks pregnant, we must make sure there's not a bruise.
Right.
No,
right.
You know what I mean? And so if you have a doctor that you can develop a relationship like that, and you have that relationship with them, when you're in labor, when you're going to triage and you're being evaluated, and they say, hey, I'm concerned, I need to check your cervix, you're going to be more willing, you're going to be more apt to say, okay, doc, because you know that doctor has your best interest at heart. Just like you brought your midwife with you to triage because you knew that she could advocate for you, maybe when you weren't sure if you could advocate for yourself. And so we just have to have patients realize they can also do that for themselves. Yes. Not that you can't bring a family member, a doula, you know, a support person with you to be another set of ears, be another voice. But again, when you establish, I say it so much, and I don't think I ever really realized it when I've had these conversations before, how powerful it truly is. But when you can really advocate for yourself and you understand the power behind it, it really goes, it goes so far. It really does. So yeah, I'm a huge proponent of patients advocating for themselves, but doing so in a way that acknowledges themselves as having autonomy and also respects the physician that they've chosen to entrust their care to. You know, when I have patients, I can sense it a mile away. If I have a patient that is mistrustful and I've never met them before, I kind of have to break down the ground rules from the beginning, and not in a way like my way or the highway, but it's like, hey, I can't help you if you don't believe me. Like you're welcome to get care elsewhere. You're welcome to get a second opinion. You don't have to see me. I'm happy to see you. But if you don't trust me for whatever reason, I haven't given you a reason not to trust me, at least this far. If you don't trust me, then I'm never going to be able to help you, because you're going to always have in the back of your mind that like, well, are these doctors telling me the right thing? You know, so there's a balance, you know, and it, like I said, it goes back to what I said in the beginning, is it has to come from a mutual place where both parties are aligned in the conversation.
Yeah, absolutely. And I love what you said. You gave a few really, really great examples of it, of when you are offering an exam or a procedure and saying why you're doing it. And if your doctor's not saying why they're doing it, as a patient, self-advocate and say, hey, why are you suggesting this? Is there another option? Tell me more about why you feel this is the best method of treatment for me. And, you know, I've heard so many times, and I've thought this myself, oh, I know the doctor's busy. I know that their time's important. I don't want to bother them with my questions. And now hearing this conversation with you, obviously I can't speak to all doctors, but it sounds like patients who self-advocate for themselves really help to create a stronger bond of trust between the patient and the doctor. And ultimately, that is a win for both people in the relationship.
Yeah, absolutely. And even to that, one thing I always add is, a doctor, if you come with 20 questions, they may not be able to answer all your questions. I mean, you know, if you have a 15 or a 20-minute visit, half of the visit you're getting your vitals taken. You might be talking about macaroni and cheese, like I said. No, just kidding. But
very important topic.
You know, so your doctor may also say, hey, it looks like you got a long list of questions. Why don't we tackle your top 3? You know, and then that allows you to say, okay, I'm really concerned about, what if I have to have a C-section? I don't know if I'm going to recover, or like, you know what I mean? Voice your top 3. Maybe you can save the, like, can I eat raisins at 3 a.m. later? Like, or maybe it doesn't matter at all. You know, I haven't personally got that question. I just totally made that up.
I'm sure
you know what I mean? Like, there are going to be some questions that are more pressing to you, and only you know what those are. And also realizing, like you said, you understand, like, honestly, the last practice I worked in, we got 15 minutes a patient. Like, that was their total visit time. Wow. I'm gonna leave it at that. Well, I won't make any disparaging comments, but 15 minutes. Wow. And that's including the time that they get put in the room and their vitals. So there are definitely, you know, we as physicians are dealing with time constraints on our end. Now, that's not how all offices are set up. So I don't want you to be like, oh my God, you're only going to get 15 minutes. You might go to some offices or some doctors and you might have an hour for, especially if you're a new patient, you might have a much longer, you might have 45 minutes. But there are time constraints. So yes, be mindful that no, I won't be able to get 20 questions answered, but I can certainly ask some questions. Most doctors should, again, I hope, I don't know where these doctors are that are like, are you crazy? But I generally go through everything, you know, I'll go through history, we'll do an exam, we'll talk about options, treatment options. And I literally will say, okay, does that all make sense? What questions do you have? So, you know, there should always be room for questions.
Right.
Most physicians are going to allow for that. Now, again, this is not every visit. If you're concerned you have a UTI and you're like, oh my God, I'm going to the bathroom every 5 seconds, your doctor may just say, ask you a few questions. Okay, let's have you leave a urine sample. And that it may just be as easy as that. So not all visits are going to be long, full of tons of questions, elaborate, flips and twirls and, all this going around in circles and having long discussions. But just having the capacity to know how to advocate is going to come in so handy in so many situations, and you won't even realize it until you are able to use it.
Right. No, absolutely. Absolutely. I think it's a skill that would pay off in many facets of life.
For sure.
So, the community and the women listening to this, most are in their postpartum phase of life. And, as a mom who is in the thick of postpartum, I kind of feel like there are times where I didn't have enough support, right? Because I feel like we have so many appointments leading up to through pregnancy, baby's born, and then it's like, bye, mom. What can a mom do to make sure that she's really getting the most out of her doctor's visits in that postpartum phase? Are there certain questions she could ask, or, things that she should be sure to bring up with her doctor, just so she can help feel more supported in that time?
I mean, there's a lot that can be done. I think you're right. We definitely see patients 5 zillion times during pregnancy, and at the end we're like, see ya. If you've had a C-section, I'll see you in 2 weeks. If not, we'll see you in 4 to 6. Hope everything's okay.
Yeah.
But quite honestly, ACOG, which is like kind of our governing body, American College of Obstetricians and Gynecologists, more recently are encouraging visits sooner.
Oh,
and
awesome.
Again, in light of everything that's going on with the coronavirus, they may not be in-person visits, but maybe doing virtual visits sooner, especially if you feel you need that support. What a traditional postpartum exam is for, usually around the 6-week mark, sometimes it's earlier, just based on scheduling, is we are kind of making sure things have gone back to normal. Your uterus has gone back to normal size. We're talking about birth control. We're talking about, we're looking for any issues with the breasts. As a mom having mastitis or, things like that. We're kind of doing an exam of the body, and also kind of, like I said, discussing contraception. Doing those things at 2 weeks it's not really needed. Your uterus is not going to be back to pre-pregnancy size at 2 weeks. But, and we also screen for depression at that visit. But can check-ins be done sooner? Absolutely. I would encourage any mom, if she's having concerns, to give her doctor's office a call, because not every doctor's office is doing a postpartum visit at 3 weeks. They're just not.
Right.
But give your doctor's office a call so they can know maybe what some of your concerns are. Some of your concerns may not even be OB-GYN related per se.
Right.
If you're having issues with the baby latching on, maybe we can have you talk to a lactation specialist and do a consultation virtually. Some lactation specialists used to come to the home, but again, depending on where you are, what the setup is like. But there's a lot of things they can do over the phone. Is it something that is going on with the baby that you kind of just think like, oh, maybe I'll just ask my OB-GYN? I'm like, no, don't ask me about the baby. Take him to peds. And maybe something that's more appropriate for the pediatrician. The pediatricians have definitely been an integral part in postpartum care. Yes. A lot of them do screening, depression screening as well, because they're seeing the baby now almost like as frequently as you were seeing your OB-GYN. So when that baby comes, you're seeing them like a few days after they're born, and then a week, and then 2 weeks, and then a month, and you're seeing them fairly frequently. So they are definitely an integral part as well. And they can be a resource in terms of if you're concerned about postpartum depression, nursing, or anything like that. But definitely from the OB-GYN standpoint, I would always encourage moms to call if they have questions or concerns. And I'll be very honest, I think there's a lot we can do as physicians, but I honestly think that most women need to have a village. And yes, your doctor can be part of your village, but some of the stuff that you really just need, like I can't come hold the baby because you just need to take a shower. I mean, you know what I mean? And you are just feeling like overwhelmed because what you really want and need is just a break.
Yeah.
I can't personally give you that. You know what I mean?
Right.
And so I think that people need to make sure they have their village.
Mm-hmm.
Again, the doctors can support you with medical things and even emotional things. But if you have that person, a mom, a sister, your best girlfriend, a neighbor, a cousin, whoever it is, or multiple people, your husband, your partner, whoever it is that you know, you can say, listen, I need an hour to myself. Can you come and hold the baby? And most people want to come and hold the baby anyway. They're just waiting for the time that they can come to your house.
So
you
true.
know, then a lot of people, you know I personally was like, who wants to come and see my baby? Who wants to, have you washed your hands for 5,000 seconds before touching her? You know,
For sure.
So, but I was definitely so grateful, you know, my mom and my sisters came and, you know, my mom made me food and, you know, everybody wants to hold the baby. Now this was 5 years ago. And so certainly, again, in these days and times, you know, we have to be conscious of who's coming in. But I would say, even in these days and times when we're being very cautious, you still need support.
Yes.
So, you know, draw on your support system. More than likely, they have been through it too. I think especially with first-time moms, you can easily fall into the trap of nobody knows what I'm dealing with. Because motherhood is hard. I mean, you've gone from being by yourself, I could just get up and just go. Even when I was pregnant, I was on the go until the very end. So even the day before my induction, I was out at the mall buying whatever and like getting my nails done. I didn't have any responsibilities to care for another little person.
Right.
Now I have a baby and I have to care for a whole new life. Like, it's a lot. And then they're up all hours of the night. You're sleep deprived. You're tired. You know, so there's so much. So finding a village is key. That would be one thing. Another thing, a tip that I gathered just over learning to be a mom. I remember, I tell people this story all the time. I remember I didn't have a baby yet. This was a while ago. And I saw a mom post, I think it was on Facebook. She had a baby. Her baby was maybe a couple months old. And she said something to the effect of, man, it's 4 o'clock and I just finally got a shower. And I remember thinking like, dang, like, why did it take her so long?
Mm-hmm.
And it really wasn't coming from a judgy place. Like, I wasn't like, oh. Yeah. It was just kind of like, 4 o'clock.
That doesn't make, yeah.
Until I had my own baby. And I remember, trust me, I was 35 when I had my daughter. And I waited for so long, partially because I'm like, I want to be ready for this. Like, I don't want to be in residency working 80 zillion hours a week and trying to take care of a baby and never seeing them. That just wasn't for me. And so I remember, I knew that being a mom was going to be hard. I knew that. Like, so I was like, I'm not setting myself up for craziness when I'm not ready to handle it. And I remember one of my goals I set before I had her, I was like, I'm taking a shower every day, period. Because I remembered that post. And I was like, the least I can do is just, whenever you take a shower, you just feel fresh. You feel good. Even if I'm just going to put back on some more pajamas, I'm taking a shower every day. And I did it. Like, so setting a goal for yourself, it could be having my hot cup of coffee I don't drink coffee, but whatever it is for you, not losing yourself. I put that in quotes because you're not really losing yourself, but you do get lost in motherhood, especially in the beginning. You kind of are just like, I'm delirious. I haven't slept. Oh my God, the baby's hungry again. I'm delirious. I haven't slept. Oh my God, did I eat? Oh, my food is cold. I remember thinking like, when am I going to eat a hot meal for the longest time? Right? Like, cause you get your food and then like, you come back an hour later, it's cold.
Yep.
So those little things, like these conversations, having conversations, to me, those things are super important in terms of support in the postpartum period, because you realize I'm not alone.
Yes.
These other moms who are near and dear to me have been through the same exact stuff. I have people who love and care for me who will come and help me. You know, there's just, it validates you as a person, as a new mom. And I think that's just so, I think it's just so critical.
Absolutely. Yeah. And the sense of vulnerability too that's required, I think, throughout this whole conversation, right?
Mhm.
This word keeps coming up for me, is being vulnerable, asking for help with your village, from your village, asking for help from your doctor, or,
Mhm.
from your family, whatever it is. Being vulnerable, asking for help, and being really specific in the help that you're asking for, I think, is so,
Yeah.
so crucial.
Yeah, for sure. For sure. Because people don't, even your spouse or your partner, they are often clueless. I mean, I'm not, you know, that sometimes
Hey, chances
they
are they're
just
clueless.
don't know how to help.
Yeah.
They
Yeah.
don't know. So you have to be very specific, like, I need you to,
XYZ. Yep. It's
because then we can often build up resentment
mm-hmm.
and be even more overwhelmed because it's like, they're not going to do it right. Let me just do it myself. Well, it's
Yeah.
like, well, maybe they just don't know how to do it. And if you just tell them, like, hey, it needs to be done like this, this, and this. If it's not done like this, it's not going to work. It's not going to be what I need. And I need this because if I have to do it, that's more work on me. You know what I mean? And then if I
Mm-hmm.
end up resenting you because I end up doing it all the time, you know what I mean? It's just,
It's
there's so
so
many
true.
dynamics at play, especially early on. And I think some of it can be avoided. And again, having these conversations lets people realize, like, oh, I didn't realize my husband needed me to like lay out exactly how to wash the nursing equipment or
Yep.
how to wash the bottles.
Yep.
Or you know what I mean?
So true.
Maybe just didn't know. And so if they can be of support in a way and you can tell them how to do it the right way the first time if they weren't aware, then that can help save you the 100 times in the future that is going to need to be done, from you feeling like you just
Yeah.
have to do it
Yeah.
and then you expending your energy to do it,
It's so
So
true.
yeah,
It is so true. So, so true.
yeah.
I think.
And people aren't mind readers. Like, you can
Yes.
sit there and feel like, oh my God, I'm doing everything. Ah! But like, and they're like over there living their best life. And you're like, don't you see me with this baby over here?
Yeah.
I
Floundering.
haven't eaten. I haven't showered. I haven't whatever
Yeah.
insert you're trying to do. And you're over there living your best life, taking a nap.
No, it's so true. I think that's such a hard point, a hard part of postpartum. I still feel that now. And my baby's 6 months old. I have an ongoing joke with my husband. It's like, oh, must be nice. And I just passive aggressively text him that. And I'm like, okay, Carly, get specific. Like, ask
Yes.
for real help.
Yeah.
Like, he wants to help. I need
Yeah.
the help. It just, it takes more effort on my end to actually
Yes.
clarify and
Yes.
communicate. So we just start singing the song from Hamilton. It was like, it must be nice. And I just sing that all day. And he's like, okay, seriously, what do you need? I'm like,
What do
okay,
you need? Yeah.
ah, you're
I
good.
think for many women, not all, obviously, we end up kind of having the do it all superwoman syndrome. It's like, I'll
Yep.
just get it done. Like, if I do it, I'll get it done faster. I'll get it done right, whatever. But we can't do that all. We can't do that all the time. We
Yeah.
just can't.
No, it's so true.
Because it will often be to our detriment, and it will often lead to us building resentment,
Yes.
which you're trying to help another little life flourish. And if you're not wanting to ask for help or being resentful about whatever, it's not going to help anybody.
No, it's so true.
So yeah, just like, reach out and ask.
Yeah, that's right. Oh my gosh, this was so helpful. I think that, you made so many great points in this conversation, and hopefully, the woman and the new mom watching this, or maybe the mom to be watching this, can
Yeah.
feel more empowered and excited to self-advocate, right? And to
Yeah.
speak up, whether it's with your partner or your spouse or your doctor.
Absolutely.
So thank you for bringing up so many good points. And I think hearing it from a trusted resource such as you carries so much weight, and really will help to empower these mamas.
Absolutely. Thank you so much for having me.
Of course.
I'm like, anytime, I'm like, I can, as you can see, I can talk and go on and on about this kind of stuff
Oh my
forever.
gosh. Well, I'm happy to do it again for sure. And there's so many things I want to talk about.
Absolutely.
Please let people know where they can connect with you so they can read more about you and your work.
Sure thing. So on social media across all platforms, it's at Dr. Kiara King. That's the fun little @ sign, DrKiarraKing. And my website is drkiaraking.com. You will find all things fashion, lifestyle, wellness, motherhood, wrapped up into a whole lot of fun.
Oh, I love it. No, that's how I found you. I found you in an article and I went to your Instagram and I was like, oh my gosh, I could just feel your energy. I was like, I need to talk to her.
Oh,
This will be such, it's just a breath of fresh air and a great conversation.
thank you.
Because postpartum can feel really heavy and lonely and isolating. And I
Yes.
think to feel your energy and to put that out into the world, just thank you so much.
Absolutely. And this one quick thing, I
Yeah.
tell moms and tell people all the time that motherhood in general can be very isolating. And it's almost like oxymoronic, like motherhood isolating, like what? But it can be, because you are here molding this one little growing creature and human being, and you're pouring yourself into it, even though all the women around you who have had children have been through that. If you're not engaging with them and welcoming them in to help you, it can be very isolating. So we don't want that.
No, it's
Mamas, don't
so
isolate
true.
yourselves in motherhood. I mean, sometimes you may want to go and hide in a closet like me right now.
That's different.
But don't isolate yourselves.
No, for sure.
I think there's so much what you are doing and what you are putting out into the world is vital.
Oh, thank you.
So keep doing the work.
Thank you.
And there's a verse in the Bible I love that basically says, like, don't despise small beginnings, because we all have to start somewhere. And I never would have thought I would be doing what I'm doing right now. Like, I knew I was going to be a physician, but I never would have thought I would be like talking on people's podcasts and on, in their, being in a magazine, or I never would have thought any of those things years ago, because I just didn't think it would happen until I started and things started evolving. So what you're doing is going to, empower so many lives of so many mothers.
Thank you.
Yeah,
Thank
yeah.
you.